welcome to Telesur. I'm Carla Gonzalez in Quito, and this is From the South. And we begin with reports from the COVID-19 around the world. Cuban health authorities have now reported a total of 25 confirmed cases. The Ministry of Public Health also reported that 716 people are isolated and under observation as possible cases, of which 205 are foreign nationals and 511 are Cubans. Of the 25 confirmed cases, 2 patients are in critical condition and being cared for by specialists. So far, the country has recorded 1 COVID-19 death of an Italian tourist. And Venezuela has diagnosed 70 positive cases of COVID-19 to date, all of which have been imported from Europe, Colombia, and the United States. The Minister of Communication, Jorge Rodriguez, denounced a publication by the Washington Post, which portrayed Venezuela as vulnerable to a greater spread of the coronavirus, without mentioning the early measures taken by the government. Rodriguez said there have been 70 cases in the country, 2 in critical condition, and 15 recovered.
Y debemos decir, con optimismo,
and we can optimistically say that of the 70 cases, we now have 15 cases which have recovered. What are we saying are these 15 cases? It's of the patients that after being diagnosed, they've gone 5 days without any type of symptom, who are not older than 65 years old, because that is a vulnerable part of the population, and who don't have any existing condition that could complicate the COVID-19. For example, hypertension, asthma, diabetes, and so forth. And so, of those 70 cases which have been diagnosed, we have 15 patients who have recovered, unfortunately not dead.
And we continue in Venezuela. The capital, Caracas, saw a second night of disinfection of public spaces as part of the contingency plans that seek to contain the spread of the COVID-19. Police, security, and civil protection forces are supporting these efforts, carried out mainly in busy sites of the city, including markets and medical centers, which continue to see a flow of people despite the quarantine measures. The authorities plan to undertake frequent disinfectations and are also calling on the population to continue observing individual and collective preventive measures. Citizens in several regions of Chile mobilized on Saturday to demand that the Sebastián Piñera government implement measures to control the spread of the COVID-19. Protesters have blocked roads to prevent residents of the capital from traveling to resorts and other towns for recreational purposes. The Chilean executive has refused to decree a mandatory quarantine, citing a negative economic impact. Santiago de Chile has seen the largest number of confirmed COVID-19 cases in the country, with 359 of the total 537 reported by health authorities.
What we're doing is demanding that the government put health barriers at the entrance of Los Andes province and also in the province of San Felipe. Over the last couple of days, only 2 points have been set up throughout Chile, and Aconcagua is one of the most strategic access points both for foreigners entering the land border as well as for the influx of vehicles from Santiago to Los Andes. So we're asking the state to set up a preventive health barrier. We still do not have today any cases of contagion in the Aconcagua region.
Now to the Caribbean. Health authorities in Trinidad and Tobago have confirmed 40 new cases of the COVID-19, bringing the total number to 49. All the new cases come from the 68 people who were repatriated from a cruise ship that was stranded in Guadeloupe.
Thursday, the 19th of March, all 68 people were swabbed as per protocol because they fit the definition of who should be swabbed because they were aboard a ship with confirmed COVID-19 patients. We got the results between 9 and 10 p.m. last night on Friday, 19th of March, which was last night. I could tell you that of the 68 people tested, 40 of the 68 have tested positive for COVID-19. 40 of the 68 have been tested for COVID-19. These are the returning citizens who were stranded on that cruise ship.
And the government of Trinidad and Tobago has announced the closure of all borders effective midnight Sunday. National Security Minister Stuart Young said the move has been taken to halt the spread of the COVID-19. He said no international flights will be allowed to enter the country. Seaports will also be closed to all vessels except those carrying food and medicine. 140 medical professionals have arrived in Jamaica to help bolster the country's response to the COVID-19. The medical brigade was received at Norman Manley International Airport by Health Minister Christopher Tufton and Cuba's Ambassador Inés Force Fernandez. The brigade is one of the many that have been sent to various countries to help in the fight against the pandemic. Jamaica has so far recorded 19 cases and 1 death.
It's a continuation of that friendship and relationship. And in the time of crisis, this emergency that we have, COVID-19, the Cuban government, the Cuban people, through Madam Ambassador and the embassy here, have risen to the occasion. They have heard our appeal and they have responded. And we are very, very elated to have today these 140 members of the medical fraternity coming in from Cuba. Now, they are going to be subjected to 14-day quarantine arrangement, right?
A Cuban medical team also arrived in Grenada over the weekend to contribute to the fight against the COVID-19 pandemic. The country has no confirmed cases so far.
These will include doctors and nurses specifically trained in accident and emergency intensive care, as well as infectious diseases. And we continue to request more. The Cuban pharmaceutical product known as interferon.
In Brazil, the governor of the state of Sao Paulo, João Doria, has ordered a 2-week quarantine effective midnight Tuesday to help halt the spread of the coronavirus. The state is the worst affected in Brazil, where 900 cases and 11 deaths have been recorded.
Starting next Tuesday, March the 24th, we decree quarantine to 645 municipalities in the state of Sao Paulo. This implies the determination, I repeat, determination. It means obligation of the closure of all non-essential businesses and services throughout the state of Sao Paulo.
After the break, Bolivia could suspend its presidential elections due to the COVID-19. Don't go away. Bol, mizu, nero, lo,
Wasser,
Aqua.
agua. Welcome back. More news at this hour. There are now about 1,200 confirmed cases of COVID-19 across the African continent, and the number of people who have succumbed to the pandemic stands at 37. A number of African countries have continued imposing measures against the spread of the pandemic, and new cases have been recorded in Uganda, Eritrea, Angola, and Madagascar. with Mozambique being the latest to confirm a case. Zimbabwe has recorded its second coronavirus case as the pandemic continues to spread on the African continent. The country's Ministry of Health and Childcare, Obadiah Moyo, has confirmed the case. Moyo said the patient diagnosed with the COVID-19 is a 30-year-old Zimbabwean man from Harare who traveled to New York on February 29th and returned home on March 9th. The first case was a man who lives in Victoria Falls and had traveled to the United Kingdom, where he presumably got infected. Bolivia's electoral authority announced the suspension of the electoral calendar for 14 days as a response to COVID-19 and proposes a dialogue process to be held with parties for the possible modification of the date of the general elections, which are currently scheduled for May 3rd.
The Supreme Electoral Authority has taken notice of the decision by the government to declare a quarantine with restriction of activities during a period of 14 days beginning tomorrow. Before this situation, the Supreme Electoral Court has decided first, and as it is an exceptional circumstance, to suspend a calendar and schedule for a period of 14 days beginning at midnight this Sunday, March 22nd. In second place, we reiterate our will to pursue a broad and plural dialogue with all political organizations participating in the 2020 process, as well as all other powers of the state, so that, marked by unity of Bolivians, a new date for voting of the 2020 general election can be defined.
In Bolivia, social sectors affiliated with the movement towards socialism denounced that the right wing will use the COVID-19 pandemic to postpone the date for the elections to allow the de facto government to hold on to power.
Bolivia's Unity Pact, a group of social organizations affiliated with the movement towards socialism, have rejected the possibility of postponing the national elections under the de facto government's exceptional measures amid the coronavirus.
We reject the postponement of the national elections, which must be held on May the 3rd. The national elections were called through the law by the executive power, and the Supreme Electoral Court must respect that.
The Unity Pact is made up of the most important social organizations of the country, which are affiliated with the movement towards socialism, whose candidates in recent polls have nearly twice the support of the other candidates in the electoral race.
We live in uncertainty. This uncertainty has to end on May 3rd, and a government must take power, one which is legitimately and democratically elected, and to work for all the Bolivians living in this country.
Elections might be suspended. We are not going to allow that. We will not accept that, because we only accept a government which is legally elected, a constitutional government, which is responsible for the problems we are seeing today.
The concern of the social organizations is the purging of voters by the Supreme Electoral Court, which they claim mainly affects the rural area, where there is no possibility to file a complaint.
The departmental executive are anticipating how many colleagues we have, because we have to have a precise number. According to reports, we are reaching 170,000. So that is a concern for the Unit Pact. It's an emergency for the Unit Pact. They cannot be paid, especially in the rural areas.
National elections were called for May 3rd as part of a political agreement to pacify the country after the coup d'etat in November last year. 8 candidates are running. 7 represent the right-wing sectors which overthrew the movement to socialism.
Italy's death toll from the COVID-19 pandemic approached 5,000 on Sunday after authorities reported 651 deaths. The latest daily toll was smaller than Saturday's record of 793 deaths, but still the second highest registered during Italy's month-long crisis. The death toll now stands at 5,476, while the number of confirmed cases has risen to 59,138.
Unfortunately, today again, we registered death of 651 people. A very simple comment on the figure, and then I'll give the floor to Professor Locatelli. Today's numbers are lower than the numbers we gave yesterday. I hope and we all hope that these numbers can be confirmed in the coming days.
On Saturday evening, Italian Prime Minister Giuseppe Conte ordered a nationwide closure of all companies and factories that are not involved in the production of essential goods and services, as health authorities struggle to halt the worsening coronavirus outbreak.
Today, we decided to take another step. The decision taken by the government is to close all productive activity throughout the territory that is not strictly necessary, crucial, indispensable to guarantee us essential goods and services.
And also, again, speaking on Cuba solidarity, the country sent a medical brigade to Italy this Saturday to contribute to the fight against the COVID-19. 52 doctors and nurses arrived in the northern Italian region of Lombardy, the worst affected by the coronavirus. This is the 6th Cuban medical brigade to travel abroad to fight the pandemic and the first to provide its services in Europe. Health authorities in Italy said the team has optimum training and experience in combating epidemics. The medical brigade will reinforce the efforts of a Chinese health team already working in the country. And on Sunday, Russia deployed 9 military planes to Italy carrying 100 medical experts and equipment to help fight the coronavirus. The Ministry of Defense said the aid mission was agreed by Russian President Vladimir Putin and Italian Prime Minister Giuseppe Conte. It added that the experts have a lot of experience in dealing with pandemics, as they have previously taken part in fighting Ebola, African swine fever, and anthrax outbreaks. This Saturday, U.S. President Donald Trump declared a major disaster in the state of New York. The state is the worst affected by the COVID-19 pandemic in the country, with over 10,000 cases. The authorities will impose a mandatory quarantine in the state starting 8 p.m. local time this Sunday. State Governor Andrew Cuomo noted that 54% of positive cases are patients aged between 18 and 49.
Every American has a role to play in defending our nation.
And China says it will step up measures to reduce the number of imported COVID-19 cases. On Sunday, the National Health Commission reported 45 imported cases and only 1 locally transmitted case. The Commission has said that all arriving international passengers will undergo a test to screen for a coronavirus, expanding a program that previously only applied to those coming from heavily hit countries.
On March 21st, all the provincial 11 regions and Xinjiang Production and Construction Corps reported 46 new confirmed cases, 6 deaths with 5 in Hubei, and 45 new suspected cases. A total of 504 people were discharged from hospital after recovery. 1,110 close contacts were removed from medical observation, and the number of severe cases decreased by 118.
Coming up, large protests against Chile's president that continue despite the COVID-19 fears. Stay with us. Thank you for joining us again. So let's take a brief look at history. South Sudan gained its independence from Sudan in 2011 and was plunged into a civil war in 2013. Attempts to form a coalition government and reach peace have failed. We bring you more on the humanitarian impact of this conflict.
Cuban Gacho is a lucky man. Shot 3 times and left for dead, he was found alive following the carnage, the bullets having missed his vital organs and airlifted to Juba for surgery.
I was shot in the shoulder and passed out. When I woke up, I had been shot in the thigh and 10 later in the leg. 3 members of our team died and 6 had serious injuries.
Cuba was airlifted from the eastern state of Jonglei to this military hospital, which has a special ward run by the International Committee of the Red Cross. It is one of the few in South Sudan equipped to treat gunshot injuries. After months of talks, President Salva Kiir formed another unity government with his rival Riek Machar in February. Almost 400,000 people were killed in the struggle for power. But as the war wound down last year, the number of gunshot patients spiked by almost 20% in international Red Cross clinics across South Sudan.
The injury on the chest, it might go into the lungs, it might cause bleeding into the lungs, and if it's on the left side, it might even hurt the heart, and they might die instantly. But most of our patients, thanks God, they are lucky and they survive these injuries.
In 2019, the International Committee of the Red Cross actually treated more patients with serious gunshot wounds than in 2018, 769 compared to 658. The fear is that 2020 could follow the same path, especially so in South Sudan, where healthcare is non-existent in remote areas, and there are about 180 doctors for a population of 12 million.
Vast majority of the patients that we treat here are patients who've suffered gunshot wounds, and they're either involved with the ongoing conflict or just with general violence that exists, particularly in the cattle community. And the most recent influx of patients we've had have been involved with a raid on a cattle camp in the middle of the country.
But this is not the only problem facing the people of South Sudan. In a country of 14 million people, 2.2 million children do not go to school. The adult literacy rate is 26.8%. And in addition to the challenges in access to health and education, it is one of the places where the youngest children are abducted and recruited by armed groups. An estimated 16,000 children have been recruited by groups and armed forces since the crisis began in December 2013. Within the country, almost 2 million people are internally displaced, while there are 2 million South Sudanese refugees in the countries such as Ethiopia, Sudan, and Uganda. Meanwhile, levels of inter-community violence still pose a threat to stability in the country. A lucky few of those gunned down, like Ngasho, are airlifted to Juba. The rest take their chances at local clinics or simply bleed out in the field. Meanwhile, the clashes show little sign of ending. Political peace may have come to South Sudan, but the path to peace between its communities is still long.
And we continue with news. On Friday, Chilean security forces violently dispersed demonstrators who had taken to the streets to protest against the administration of President Sebastián Piñera. Police used tear gas and water cannon against the demonstrators who have vowed to continue taking to the streets until Piñera steps down. More than 30 people have died at the hands of police officers since the protests broke out in October last year. The demonstrations were triggered by a hike in metro transport fares and quickly turned into a movement against inequality and other social issues.
The people of Chile are already awake. I ask my countrymen to not go to sleep because we no longer have to believe them. The coronavirus may kill us, but not as much as them. If the coronavirus does not kill us, they will starve us.
March 21st marks the 60th anniversary of Sharpeville massacre in South Africa. On March 21st, 1960, police officers opened fire on a group of unarmed black protesters in the township of Sharpeville on the outskirts of Johannesburg, killing 69 and wounding 186. The group was protesting against the so-called passed laws that restricted the movement of black people. The incident became a turning point in the struggle against apartheid as the African National Congress abandoned nonviolent protests and launched an armed struggle against the apartheid government.
As we mark this important anniversary, We, the people of South Africa, must pay tribute to this exceptional generation for their bravery in the struggle for liberation. We dare not forget their collective sacrifices and the vision for which they laid down their lives. Through their selfless sacrifices, they ensured that the system that entrenched oppression and racial injustice in our country was dealt a decisive blow.
Also in South Africa, the Economic Freedom Fighters Party has called on the United States to lift the unilateral sanctions imposed on Cuba, Venezuela and Iran, and called them a violation of human rights which are impeding the fight against the COVID-19 pandemic. The party said sanctions are a means of economic terrorism and violate the right of sovereign countries to subscribe to economic and political policies they deem fit for their nations. The party regretted that in a time of a global pandemic, there are nations which are isolated from international trade. One person has been killed and several others injured in Guinea during clashes between security forces and demonstrators who protested against a controversial constitutional referendum held on Sunday. President Alpha Conde is proposing a change to the constitution, allegedly to improve gender equality and introduce other social reforms. But his opponents fear the real motive is to remove presidential term limits in order for him to run for a third term. And with that, we end the news brief, but you can find these and other stories on our website. For Telesur English, I'm Carla Gonzalez. Thank you for watching.